So I'm always seeing creators on here talk about the peptides you should take. Well, no one ever talks about the peptides you shouldn't take. I'm going to go over a few of the ones that I would absolutely not recommend because they'll ruin your life. First one being GHK copper. Don't take this peptide. Your skin's going to get way too clear. You're going to remove all your wrinkles and you're not actually going to look your age, and that would be lying. IGF-1 LR3, you're going to put on way too much muscle. Your clothes aren't going to fit you anymore. You're going to have to buy a whole new wardrobe. I would not recommend that. NAD+, you're going to have way too much energy and way too much focus, and you'd actually get things done as opposed to rotting and doing nothing. Epitalon, you're going to live way too...
All right, let's stop for a second. You call this biohacking? Well, I call it polypharmacy with a ring light. You're casually listing GHKCU, BPC, IGF-1, LR3, NAD+, retatrutide, melanozyme, C-Max, like they're little wellness vitamins, but they're not. These are biologically active compounds that affect growth factors, metabolism, pigmentation, neurotransmitters, appetite, and hormones. And stacking multiple compounds that hit completely different pathways is exactly how side effects and drug interactions multiply. Let's talk about one of them, IGF-1 LR3. This isn't some cute muscle peptide. IGF-1 signaling drives cell growth and cell survival. That pathway is literally the same one studied in oncology because it pushes cells to proliferation. And you advertise it like it's a supplement you take after workout. Well, now imagine stimulating that pathway while also taking drugs that change metabolism, appetite signaling, and hormone pathways. That's not optimization. And melanotan? People treat it like a tanning peptide. In reality, it hits the melanocortic system, which affects pigmentation, sexual arousal, blood pressure, mood, and autonomic signaling. That's why people report nausea, flushing, dizziness, and heart rate changes. So when someone's stacking growth factor analogs, appetite drugs, melanocortic agonists, and neuropeptides all at the same time, that's not longevity. That's unsupervised polypharmacy for content. And the real question isn't which peptide you should take. It's why someone with no medical training is casually recommending 7 pharmacologically active compounds at once.